Good afternoon. Now I am going to present about Ayurveda refractive errors. Dry eyes computer vision syndrome. Introduction. Refractive errors are common eye condition which occurs due to abnormal eye shape, which prevents light from focusing directly on the back of eye. It is focused either in front of eye or back of eye. It results in blurry vision, among other symptoms. Causes of refractive errors. Causes of refractive errors. Refractive errors can happen and due to one or three or two of the following reasons. There is change in eye shape. Eye is either short or long. If it is eye is short, it results in hypermetropia. If eye is long, it results in myopia. Also, there is other cause of refractive error is cornea is either flat or steep. In addition to this, thin or thick lens is also responsible for refractive errors. Thick lenses causes presbyopia. Symptoms of refractive errors. Symptoms of refractive errors includes blurred vision, headache, eye strain, and squinting. And there is problem to see objects at distance, and also in this is in myopia. In hypermetropia, there is a problem to see objects that are nearby. Diagnosis. Refractive errors are diagnosed with help of visual acuity tests. Visual acuity test is done using Sneller's chart. And other tests include autorefractometer, and slit lamp examination. Slit lamp examination gives an idea about different structures of eye. After this refractive errors, if there is any defect, glasses are prescribed. Management with Ayurveda. Refractive errors are can be corrected with Ayurvedic treatment, but this prognosis depends upon type of refractive errors, severity of symptoms. If more severe, they are difficult to cure. If less less refractive power. It can be cured with Shodhana therapies and Kriya Kalpas. It also depends upon of uh, commitment of patient towards the treatment. Refractive error in Ayurveda, first Kosha Shodhana is done, which restores the balance, imbalance doshas in the body. Next, the medicines are prescribed, which results in proper absorption of medicine and cure of disease. Types of refractive errors are myopia, hypermetropia, astigmatism, and presbyopia. Myopia. Now, detailed description of myopia includes definition, types, uh, causes of myopia, symptoms, and treatment aspect. Treatment aspect includes prevention of disease and management. Myopia is also known as short-sightedness. In short-sightedness, parallel rays of light falling from infinity are focused in front of retina when accommodation is at rest. Types of myopia include axial myopia, curvature myopia, index myopia. Axial myopia occurs due to increase in anterior posterior length of eyeball. The normal shape of eyeball is round, but in myopia it is too long or oval shape. Second type is curvature myopia. In curvature myopia, there is increase in curvature of cornea or lens or both. That is cornea surface is steep shape. Index myopia results from increase in refractive index of lens. This is due to nuclear sclerosis of lens. That is, the lens becomes hard. Symptoms of myopia includes uh, blurred vision, unable to see distant objects, headache, eye strain, and squint. Patient partially closes eyelids to see clearly. In adults with myopia find difficult to read street signs and signs which are far away. Some adults have problem in nighttime driving, even if they can see clearly in daylight. This condition is known as night myopia. Children mainly are diagnosed with myopia in school. during school age. They find difficult to read uh, letters in backboard at from backbenches. Also, in addition to it, small children, it can be diagnosed with following symptoms like they blink excessively, they rub their eyes frequently, they sit close to television, they persistently squint, they are unaware of distant objects. Current effective treatments of myopia includes atropine drops, high, moderate, low doses, and also bifocal spectacles, plus bifocal spectacle lenses. Mm. Pathology of myopia is due to initiation of Vata and Pitta dosha. Ayurvedic primitive aspects include high exercise, balanced diet, lifestyle, panchakarma therapies. This prevent progression of diseases. Preventive measures of preventive measures of myopia include uh, proper sleep, food, exercise, lifestyle changes, dinacharya, netrikriya kalpas, and also in treatment aspect, seasonal detox. It comes under prevention and both cure. Food, in preventive aspect, first is food. Food should be taken which is rich in antioxidants. Plus, it should have vitamins A, C, E, and also micronutrients like zinc should be present. Food also should contain omega-3 fatty acids, lutein, zeaxanthin. Vitamin C rich foods like citrus fruits, vitamin D rich foods like almond, legumes, beans, which are rich in zinc, and also eggs which are rich in zinc, lutein, zeaxanthin should be taken. Vitamin A rich foods like orange color fruits and vegetables like sweet potato, carrots, mangoes, apricots should be included. Sleep. Uh, Second aspect is sleep. Uh, People with myopia have decreased sleep due to delayed circadian rhythms and lower production of melatonin in brain. Also, this is a risk factor. Decreased sleep is also risk factor for myopia. People who who use more digital devices are prone to myopia, especially in night. Eye exercises. Third one is eye exercises. Eye exercises include 20-20-20 rule. That is, for every 20 minutes, take a 20-second break and focus eyes on something which is 20 feet away. This helps in reducing eye fatigue. Uh, Next one, changing the focus with the help of finger. Next, scanning the room. This should be done mindfully. Sit comfortably in a room and focus on different which are near and far away, and visualize them. Lifestyle changes include reduced usage of digital devices, more outdoor games, more spending more time outdoors in case of children, not reading while lying down, sitting far away from TV. Dinacharya aspects in prevention include Akshinjana, repeatedly washing eyes with water. Abhyanga oil massage should be done to head and feet. Also Anjana, like Saviramanjana, Srotanjana. Saviramanjana can be used daily, Srotanjana once weekly. Using Kshatrayana, using umbrella helps in prevention. Using umbrella helps in prevention of sunlight and wind and this Padatra Dharana. Using slippers. Using slippers helps in protecting slippers helps in protecting feet, which has important veins connected to eyes. Pada prakshalana. Pada prakshalana includes washing legs with water. In treatment aspect of myopia, there is Kriya Kalpas. Kriya Kalpas like Tarpana is most effective treatment for myopia. Publications related to this treatment of myopia in Ayurveda include Akshadarpana is done with two groups are taken, and one group is given Akshadarpana, other group is given Akshadarpana plus Nasya. Those who are given Akshitarpana Nasya got a good symptomatic relief, then only with Akshitarpana. Single formulation, normally for Akshitarpana, purification is done with Virechana and then Nasya is given. And next, Akshitarpana is done. This is very helpful in myopia. Many research and clinical trials were done, and they proved that this this all are helpful in myopia to great extent. In addition to this, internal medications include Triphala Churna with honey, Estimadu Churna with honey and ghee, Amlaki Churna with water, Amlaki Rasayana can be given twice a day. Triphala Gurta can be taken internally. Mahatriphala 2 teaspoons a day, 2 times a day. And herbo mineral formulations include Saptamrita Loha and Datri Loha. Second refractive error is hypermetropia. Hypermetropia is far-sightedness. In this disorder, light is focused in the behind the retina instead of on the retina. In this, nearby objects are not properly seen. Causes of this hypermetropia include abnormal shape of cornea. It is also a genetic disorder inherited from parents. As in older persons, it is seen because the lens becomes stiff. Types of hypermetropia includes axial hypermetropia, curvature hypermetropia, index hypermetropia, and positional hypermetropia. Positional hypermetropia results in a posterior placement of a lens. Index hypermetropia is due to a change in refractive index of lens. Curvature hypermetropia is due to flatter cornea or lens, or both. Symptoms include difficulty in seeing nearby objects. There is squint, headache, eye strain. Children with this disorder, if left untreated, leads to problems like squint and lazy eye. Treatment includes mm, uh, children with this disorder they will adjust, but in old people they become less adapted and needs treatment. Treatment includes prescription glasses, contact lenses, and laser eye surgery. Laser eye surgery, there is change in shape of cornea. Third refractive error is astigmatism. Astigmatism is when cornea is not properly round. Causes includes eye injury, eye disease, or it is due to previous surgery, eye surgeries. Astigmatism symptoms include blurred vision, distorted vision, eye strain, headache, trouble seeing at night. Diagnosis of astigmatism includes phoropter, keratometer, autorefractometer, corneal topography. Treatment aspects include treatment with glasses, contact lens. These contact lenses are two types: soft lenses and hard lenses. Soft lenses are also called toric lenses. They are designed in such a way to return to the light rays return to the same spot each time. Second type of contact lenses are rigid hard lenses. This is so better choice if astigmatism is severe. Surgery includes LASIK surgery or PRK. And third one is astigmatic keratotomy or limbal relaxing incisions is another option. LASIK stands for laser assisted in situ keratomyolysis. In this cornea is reshaped. This procedure includes eyes numbed with eye drops. Then with the help of mechanical device, a thin flap is made on the cornea. Then they'll expose the central layers of cornea and you introduce laser. Then they return the flap to original position. Finally, mm, anti-inflammatory and antibiotic eye drops are given. This is a day procedure. So I need to stay in hospital. Presbyopia includes Fourth refractive disorder is presbyopia. Causes of presbyopia is due to aging. It normally occurs in early. It normally occurs in 40s and worsens around 60 years of age, 60 to 65 years of age. In this, there is hardening of lens of eye, which occurs due to aging. Lens become rigid and it can no longer change its shape in order to focus images. Risk factors include increased risk, also other medical conditions like diabetes, multiple sclerosis, and cardiovascular disease. Using certain drugs like antidepressants, antihistamines, and diuretics also are called risk factors. Symptoms include main symptom is blurred vision while reading books. Uh, Treatment include reading glasses with multifocal lens. These glasses are treated as a progressive lens, bifocal glasses, and trifocal glasses. Contact lenses are also used. In addition to this, eye surgery is prescribed for presbyopia. Surgery options are multifocal LASIK, refractive lens exchange to implant multifocal or accommodating intraocular lenses. And the third type of surgery is conductive keratoplasty. The second disease is dry eyes. Causes of dry eyes is due to abnormality of tear gland and use of antidepressants. Also, it is also due to anxiety and stress. Irritation also of eyes due to prolonged exposure to bright lights computer screen. Also, other disorders like diabetes, rheumatoid arthritis, scleroderma, Sjogren's syndrome, thyroid disease, vitamin A deficiency, old age, and certain neurological disorders, and reading a lot, staring at screen are also the risk factors for dry eyes. Women are more likely to have dry eyes than men. People who wear contact lenses also are more prone to dry eyes than who use spectacles. Symptoms of dry eyes include pain in the eyes, burning sensation in the eyes, eye fatigue, blurred vision, and also light sensitivity. Tears are not found when foreign objects or eyelashes enter into eye. Due to if dry eyes are not treated, it results in glaucoma, corneal ulcers, and also eye is prone to many infections. Management is done with the help of lubricating eye drops, eating a lot of vitamin-rich food, and avoiding smoking. Third disease is computer vision syndrome. They are group of eye-related disorders where there is occurs due to prolonged use of digital screens. Symptoms include dry eyes, itchy eyes, blurred vision, nearsightedness like myopia, headache, neck pain, and shoulder pain. There is also eye strain. Tips for preventing the symptoms include blink eyes regularly, placing screen at 20 to 28 inches from the eye, ensure there is adequate lighting, take regular rest breaks. If there is any eye problem, use eyeglasses or lenses to correct underlying eye problem. And also sitting comfortably with both feet flat on floor and supporting arms in place while typing. This concludes my presentation on refractive errors, dry eyes, and computer vision syndrome.